When people imagine what would it feel like to go insane, when they fear losing control, becoming inadequate, looking stupid, many usually think of schizophrenia, that evil voices torment you and push you to kill someone. You either stand in a stupor, or your body trembles like you're possessed, or you gaze into nowhere. Well, you get the idea. The fact that depression or alcohol addiction can be equally debilitating and high risk for suicide usually doesn't come to mind as a primary association with mental illness. No other condition has so many myths and misconceptions as schizophrenia, and people who are diagnosed with a psychotic disorder are often immediately labeled as doomed, that they no longer will be able to do any work, build relationships, go to university, be good parents, that they will definitely become aggressive, they will develop many different personalities, and it's better to keep them in a hospital or under strict supervision at home. And often not only families and close friends think so, but even some psychiatrists and nurses have the feeling that the fate of these sick people is quite bleak. In this video, I would like to challenge this dull perception of schizophrenia. Of course, I will go through the symptoms and methods of treatment, but the most important thing for me as a psychotherapist is to eliminate people's dread of schizophrenia as a phenomenon, because stigma often prevents the recovery. I worked in a mental health hospital, and I observed very closely how public spheres don't really allow a person to get better. It's like they get stuck in the revolving doors, facing frequent relapses due to the fact that society doesn't even want to look into their direction, let alone offer them a job or friendship. And what really happens? A person becomes isolated, even worse, homeless, due to the lack of opportunities to support themselves financially, and their condition only worsens and their spirit deteriorates. But this could have been prevented if treated with understanding, sympathy, kindness, knowledge, and most importantly, lack of fear. By the way, not everywhere in the world schizophrenia is perceived as something negative. In some cultures, the first manifestations of hallucinations are, on the contrary, an experience of spiritual awakening that reveals person's inner healing abilities and creative talents. Such person is very respected and appreciated in their community. But let's discuss this step by step. Welcome to Universe Soul, a channel about psychology and complex human nature. I'm very happy to see you here. My name is Karina. I'm a holistic psychotherapist, an intuitive empath, meaning I connect deeply with others and I sense people's emotions and energies. So, is schizophrenia an illness or a gift? The first thing I would like to shed light on is that schizophrenia is rather a spectrum of different conditions that are similar to each other, and it's not one specific disease with the same symptoms for everyone. There is no such thing as a typical case of schizophrenia. And how exactly is the diagnosis achieved? At least two psychiatrists must agree that a person has schizophrenia. But studies show that this agreement on a diagnosis doesn't exceed 65%, which means that doctors often want to give a different diagnosis. This undermines the whole diagnostic system, as it turns out to be quite subjective. Symptoms can range from subtle to severe. Each person has their own background and specific factors and circumstances at play that explain the manifestation of mental health problems. Someone exhibits a whole range of delusions and hallucinations, and someone has only persecutory delusions. Someone's triggers are genetics combined with smoking cannabis, but for another person, no one in the family had schizophrenia, there was no access to drugs where they lived, but childhood sexual abuse became the main trigger. Psychotic disorders usually first seen in late adolescence, but can be observed later in women. There is some speculation that estrogen protects against early onset and clinical complexity. Psychosis in women often occurs during phases of low hormone levels, for example, during periods or menopause. And relapses don't usually occur during pregnancy when estrogen levels are high, but this is only one of many theories. Symptoms are divided into positive and negative. Positive means that something has been added to your normal state of health, and this includes hallucinations. The most common are auditory hallucinations, in which voices can comment on what is happening right now. They might argue with you, order you to do something, for instance, swear at someone or hit them. But I want to emphasize right away that people diagnosed with schizophrenia rarely turn into an aggressor. The number of cases when someone was convicted of a brutal murder due to insanity is only 1%. If a person tried to hide the body, the evidence, if they tried to lead the police into a dead end, which happens in almost all cases of murders, then this already means that they are aware what they've done is wrong and consequences will follow. So I'm not sure if that's good news for you or not, but people who rape or kill most likely clearly understand what they're doing. Yes, they can refer to statements that their mind went dark and all blurry, but these are rather excuses than schizophrenia. And what really explains their deeds is that they lack empathy, they're quite impulsive, and circumstances turn to be in their favor. If we take serial killers, the first incident of violence often occurs by accident, during which a person experienced tremendous excitement or pleasure that they didn't expect. And to put it very simply, the addiction develops. There's an addiction to heroin, for instance, to food, to sex, and sometimes to murder. In the context of schizophrenia, yes, there are some cases when a person turns dangerous, but they're very rare, as I already mentioned, and usually in those who received no treatment, no emotional support, became an outcast, and abused drugs. You shouldn't ascribe this template to everyone who is struggling with psychosis and is really trying to improve their health and their life in general. And also I want to point out that those with a psychotic disorder are more likely to be abused because others can manipulate them or their finances or their freedom. Returning to hallucinations, not necessarily that voices are always only negative. Some people describe that the voices they hear, in fact, support them, calm them down, and say kind words to them. You can also see, smell, taste, and feel things that are not real, but this occurs less often than hearing things. Delusional ideas represent another kind of positive symptoms and can include beliefs that someone can read your mind or implant new thoughts in it. Sometimes people start wearing earplugs so that no one can penetrate their brain. Or you have delusions of persecution, paranoia, believing that someone wants to harm you and is plotting something horrible against you. For example, a person when using subway thinks that all passengers are actors or agents who are spying on them, and this causes huge anxiety. Erotomanic delusions, when you believe, let's say, a very famous singer is in love with you and sends you sweet and tender messages through the lyrics of their songs. If there is a real possibility, for instance, a person lives in LA where there are many celebrities, then they can become a stalker. In general, it's very interesting that when many people believe in something, for example, that the earth is flat, and they obsessively present evidence to everyone, then this is normal. But if one person believes that a forest fairy lives in the attic, then for some reason this is immediately a symptom of schizophrenia. I mean, there is no specific line where vivid imagination ends and psychosis begins. So, Does it mean that psychosis is determined by whether you believe in something that is trending or not? And there are many examples of this. Belief in the Illuminati, that if you don't keep your virginity before you marry someone, you will go to hell. Believe that Martians live on Mars. Believe that COVID vaccine has microchips in it, and so on. And straight away I have another question for you. Does insanity cause discomfort to the person who has symptoms? Or is it just that their hallucination didn't coincide with the majority and society feels discomfort? I personally really love this argument that any mental deviation from the norm is a social judgment. It's just a manifestation of power of one person over another, the desire to control socially unacceptable behavior. Put it back in a box. I'm healthy and you're sick. I regulate the rules how to live, and you, my dear, just follow them. I said first that I'm a doctor, and you were too late to say so. Unfortunately, in my opinion, we haven't advanced too far in humanity. Then we have disorganized thinking, when the clarity of your thoughts aggravates and it becomes very difficult to express what's on your mind. A person can start putting every sentence in rhyme, for example, or word salad that's very confusing for others to understand. They might giggle all the time or zone out, or the language structure breaks down completely and they can't form any coherent or logical thoughts or speech. Another positive symptom is the disorganized movement. An example would be catatonic behavior, when you either exaggerate your movements or you freeze in one pose for a long time and you don't respond to any instructions. There are also negative symptoms that almost no one talks about, but which can really destroy a person's life. It means that something has been taken away from your normal state of health. Your thinking, perception and behavior become even more aloof. To begin with, you stop taking care of yourself. Personal hygiene and appearance don't matter anymore. You may become reluctant to leave your house or your bedroom, and all you want to do is to lie in bed most of the day. You might respond to news inappropriately. For example, laugh at sad news or seem to be unhappy when good news arrive. It becomes difficult to experience pleasure or joy. You are often apathetic and you lose interest in activities that used to be important for you. For example, your work, study, sports, hobbies. You become more and more disinterested in conversations with others and begin responding very briefly to questions. There may be long pauses, and in extreme cases, a person can become completely mute. There may be obvious difficulty concentrating and inability to focus even on simple tasks such as making yourself a cup of tea. You might experience decrease in your sexual drive and become unable to achieve an orgasm. Your energy levels drop with each day and a feeling of inner emptiness becomes overwhelming. Naturally, a person begins to avoid social contacts as they become very problematic to sustain, and person prefers to spend most of the time alone because it's safer and less stressful. Depression and anxiety often accompany schizophrenia, which ultimately exacerbates the clinical picture. For example, depression can cause secondary negative symptoms, and panic attacks can cause even bigger paranoia. Also, many people turn to smoking and drinking, but rather as a form of to self-soothe or self-medicate, to alleviate the pain and environmental stress, and not to make things worse on purpose. It's important to acknowledge this and not jump to conclusions. The reasons why a person develops schizophrenia are very broad. We still don't know much, and as I have already hinted, perhaps we're talking about different types of disorders combined under one diagnostic label. Until we understand all of this much better, it will be very difficult for us to determine which person will get sick and which one will not. Some researchers point out when someone has the first episode and we can physically observe abnormalities in the brain scans, it's too late. The brain impairment is in full swing, and prevention of schizophrenia should begin several years before that. The disorder probably germinated in pregnancy, obstetric complications, bleeding during gestation period, fetal malformations in the second trimester, a key stage of neurodevelopment, infections, emergency cesarean, low birth weight. All of these are associated with the risk of mental health problems later in life. But this means we should screen all children, even the healthy ones, to notice any initial peculiarities and save a few from developing full-blown psychosis or other disorders 10 years later. And from the medical funding standpoint, this unfortunately is way too expensive and not justified enough. The spectrum of risk factors runs from heredity and differences in brain chemistry to stressful life events and the presence of psychological trauma. So the main explanation is based on two main risk factors. The primary influence is genetics, and that some biological determinants make a person more vulnerable. And the secondary factor is that at some point in their life, usually during adolescence, there was some kind of stress that provoked the first symptoms to emerge. There are suggestions that life in big cities provokes symptoms, or immigration and inability to integrate fully in a different country, or lack of sun and vitamin D in some countries can all play a role. Another theory is that since only people are susceptible to schizophrenia and animals don't have it, that is due to the development of our speech abilities and languages. Finding the right treatment can be a lengthy process. It takes patience and understanding that doctors don't have all the answers yet. If we're talking about drugs, antipsychotics usually don't start working immediately, and changes are felt from 2 weeks to 3 months. And people react differently to these medications. Someone has lots of side effects and puts on weight, and someone doesn't exhibit any of it. In some cases, the dose can be increased or the type of medication can be changed, and most people with schizophrenia will be offered antidepressants at some stage, often after a psychotic episode when depression becomes a major problem. There are many arguments in scientific world that antipsychotics treat one thing, harm another, and antidepressants cause suicidal thoughts. So disputes on drug treatment never stop really. It's also crucial to find a suitable psychologist or psychotherapist. A weekly session with a good therapist who is non-judgmental, understanding, and avoids labels can help manage symptoms and day-to-day problems. It's also important how a person's family and friends react to their condition and complications. This can greatly affect the progress of their recovery. Families that become very hostile or irritated by a person's behavior often hinder rehabilitation, and in this case a family therapy is needed to explain to everyone what schizophrenia is and what's the most constructive approach, and also provide an emotional support to carers, which is equally important. Often they're left in the dark and isolated as well. Caring for someone with a history of psychosis is a roller coaster for everyone. Support groups can also be extremely helpful. Many people receive a lot of help and feel empowered as they have the opportunity to discuss their symptoms and problems with people who have similar experiences of psychosis. Speaking of cultural differences, Western mentality views psychological abnormality more as illness or disability, while some Eastern cultures or shamanic tribes view such state of consciousness as a path to enlightenment. For example, Dayak people in Malaysia, Indonesia, and Brunei, they consider it absurd that someone can read your thoughts. For them, people and spirits communicate only verbally, so they have no fear that someone can penetrate their brain and tell them what to do, and these people don't exhibit auditory hallucinations. Dagar tribes in Africa believe that mental illness is a path to healing, and generally very good news from the spiritual world. When someone among them experiences symptoms of psychosis, in their opinion, the person shouldn't be labeled as mad, but should be shown a path to help this sacred information from higher dimensions flow through him. And if this force is counteracted, for example, messages from spirits are cut off by pills, then this is what causes mental illness and distortions. If a person is allowed to strengthen his connection with the spirits, then he becomes a bridge between different worlds and is able to help others find their purpose and their calling. One of their shamans once visited America and was shocked by how doctors in mental health hospital treated patients. To him it looked like they're totally suppressed, and he saw many spiritual entities hovering around them, and eventually he got very upset at how the Western world treats those who he considered to be special, knowing and gifted. Later he explained that in the case of psychosis, at first there is no control over how many or how often, what messages or images are flooded into a person's mind. They have no filter yet, and this influx of information causes panic or seizures. So when this happens, another shaman who has already gone through this process should help this individual to clear their aura and make sense of these energies. And once the clutter is out, spirits can peacefully connect with the human soul and deliver what they're supposed to deliver. And let's not forget that a huge number of people every year specifically go to South America, for example, to experience ayahuasca and set off hallucinations intentionally in order to connect with the other world and find the meaning of life or treat the trauma that a conventional mental health system failed to achieve. And often these people describe it as the best experience of their life, a real self-discovery and a complete rebirth. Of course, I leave it to you which explanation of schizophrenia resonates with you. But undoubtedly, we live in a culture that loves to stigmatize crisis and refuses to accept people fully who go through some sort of upheaval. When someone falls into this involuntary state of altered consciousness, frankly, most people just want them to dissolve somehow and somewhere, not cause any trouble, not become a burden. Why do we see it as purely negative affair and not as an incredible adventure to spiritual growth, to healing that we all have within us, to self-acceptance? The kinder we are in helping people go through their emotional breakdowns, which surely have solid reasons in the first place, it didn't just manifest because of nothing, the more likely these people will find their true self sooner and become amazing mentors with a valuable life experience. Why do we fight this? I personally don't fully understand. Thank you for joining me today. Please like this video, feel free to share or comment below, and subscribe to my channel if you wish to learn more about psychology, human mind, relationships, mental health, and more. You might discover yourself from a new perspective, or other people's motivations will become clearer to you. Maybe you are striving for a sense of belonging and warm, supportive community. This channel is for you then. For further inquiries, please check my website for more information, and you're welcome to contact me via email, WhatsApp, Instagram or Telegram. All contact details are provided in the description below. For now, I wish you a fantastic day. Take care of yourself. Bye.